Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening. I'm Merrick Wetzler for South Jersey Orthopedic Associates with offices in Turnersville and Voorhees, and I'm here tonight with...
I'm Dave Anselmo from Korski's Physical Therapy and offices in Sicklerville, Woodbury, Pennsville, and Washington Township, and welcome to Sports Doctor.
We are replacing your medical reporter tonight, so please bear with us. We are not professionals here. Anyway, we're going to be talking about general sports injuries tonight. That's going to be talking about anything from knees, shoulders, ankles, hips. Whatever your problem is, we'll be able to help you out with it. The numbers again to call are 1-856-767-8884 or toll free 1-888-634-7488. You can also email us at mwpsg@aol.com. The first thing they asked me to talk about tonight is it okay to get soreness after exercise? And to just go right into it, yes, it's okay to get soreness after exercises. What happens after you start up an exercise program when you really haven't done anything for a while is you build up lactic acid in these muscles. These muscles are not used to working hard. They extrude the energy, they build up the lactic acid, and because of the lactic acid buildup, it is appropriate to get soreness. This soreness should go away in a couple days. It should not be in one spot. It should be generalized muscle achiness. So if you do have soreness in one particular spot, then I recommend you go getting evaluated by a health professional. One way you could do that is that Korski's Physical Therapy will be having free evaluations at their Sicklerville office. You can call and make an appointment there at 856-728-1900. What else you want to talk about tonight, Dave?
Some of the things as far as some people, what do they do if they have not exercised for several months or several years, actually? I highly recommend for these people to go see their family physician just to get a medical clearance for any underlying factors that might limit their ability to be able to participate in an exercise program in a safe fashion. For example, is cardiac problems or orthopedic problems that might cause further problems to occur. So I highly recommend anyone that has not done anything as far as exercise or been involved in any type of supervised exercise program to see their family physician just to get a medical clearance.
Another thing about it, anytime you do start an exercise program after getting the medical clearance, is start slowly. You know, you never want to go too quickly with an exercise program. You know, the body, there's a war between the body breaking it down as you exercises and fixing it or remodeling or the healing process. If you break down too much, what's going to happen is that it's going to get greater than the reparative process, and you can develop stress type injuries, especially of the foot or the tibia, or even if you're a thrower, you can get it of your upper extremity. Rowers get it in the ribs and so forth. So every time you do something, you should start slowly. And a general rule is you should not increase your activity, either your quantity or intensity, by more than 10 to 20% per week. So if you're doing 3, 4, 5 miles a week, then the next week don't do more than 6 miles. Just about 10 to 20% increase in intensity and quantity is a good rule of thumb when you're trying to do an exercise program.
I think it's a very good point that you made there, because I think a lot of people you see that come into the clinic are exactly that. They go into the gym for the first time in several months or several years, and they just feel really strong at that time, which you will the first time you go into the gym, and they try to do too much, and they just overdo it, and they cause some problems like tendinitis or inflammation, or they tear a muscle and can cause more problems than what they really want to get into to do. So
I think another good thing about it is today we have the luxury of having all these great machines. It's very easy to cross-train, especially as you get older, like like in the 40s or the 50s, when you start an exercise program. The pounding exercise is good, but your body can't take as much of it as it used to be when it was in the 20s and 30s. The elliptical machine, the Stairmaster, the bicycle, all great ways to have exercises and really to use the same muscles you do as running, but not with the pounding type activities. If you do one part of the body on one day, do another part the next day. Don't do the same things over and over again. Get a good exercise regime and a good diffuse body workout rather than concentrating on one particular part.
Very good part, very important. Another thing we want to talk about a little bit tonight about softball players and baseball players. A little bit about throwing. We see a lot of problems with these people having injuries, and I think a lot of it has to do with what we're talking about tonight is that preseason conditioning. I think it's very important that a lot of these athletes get involved in a preseason conditioning program prior to getting into their sport. I think that we're finding that that alone will help to prevent a lot of these injuries that we're seeing with the elbow and the shoulder. And it's not just doing those pre-conditioning exercises, but preparing and learning how to pitch. Working on proper body mechanics, I think, is very important. People just work on their shoulder and their elbow, and I think you really need to learn the proper way of pitching, those body mechanics of it. So getting involved in a program, which there are a lot of them starting up now, and learning and teaching people more about the proper way of pitching. And I think it's very worth getting involved in this type of program.
We have a caller on the phone. We have Shirley from Williamstown. How can we help you today, Shirley?
Hi. In the beginning of the show, you mentioned that something about lactic acid and how your muscles cramp up when you're working out. What do you do when that happens?
Well, what you do when it happens is, if it's the next day, I recommend that you do a gentle stretch and a gentle warm-up to get the blood flowing in your muscles. Therefore, by getting increased blood flow to the muscles, you can help remove the lactic acid and actually reduce the amount of soreness you have, and actually the length of the soreness, how long you will have it. So it's not a bad idea that after you have a heavy workout one day, is to do something light the next day just to get the blood flowing. Recent studies have actually shown that warming up gently like this is almost better than stretching. So getting the blood flow in the muscles is very important, especially after a heavy workout.
Very important point. And I think another thing you could add to that is not only warming up prior to doing exercises, but actually doing a stretching program and cooling down after you do that exercise is just as important as doing it before. I think a lot of people, after they do a long run, they need to cool down and do a good stretch after doing that, because that will help to prevent some of the lactic acid from building up.
Another thing, if you have a pre-existing injury, say you have a knee injury and you're a runner, or you have a shoulder injury and you're going to play basketball, you're going to swim, whatever, I recommend actually taking some anti-inflammatories if you're able to. If you have a stomach problem, you shouldn't do it, or if it's contraindicated because of other medical problems, you shouldn't. But taking 2 Advil before you do an exercise will help prevent inflammation and thus possibly reduce the amount of soreness you have after exercise. Icing it after, if you have an injured part afterwards, is also very good. And like Dave said, cooling down is also very important.
Very good. The important point you just said is cooling down and icing. That was one of the questions that I get asked a lot of times too. Should pitchers cool down, or should they ice down after they throw a game? Is it for show, or is it really important? Well, it's absolutely very important to do that after you do anything, because pitching is very traumatic to the shoulder. Whether you're throwing underhand or overhand, it's very important to ice it down for 20 minutes at least to do that. You don't want to go over a half-hour point because you get the reverse effect and it'll actually swell up more. So it's very important. You get through the stages of ice, which is cold. You'll feel burning, you'll feel aching, then you will feel numbness. That usually occurs within a 20-minute period of time. That's exactly all you really need to do that, but it's very important to do that after.
Dave, you mentioned something earlier about the appropriate preseason exercise program. Just to emphasize this a little bit more, the shoulder is like a golf ball on a golf tee. It does not have a lot of intrinsic stability. What's called to hold the shoulder in place there are 2 things, are dynamic as well as the static stabilizers. The dynamic stabilizers are the ligaments, and they're stable. They're ligaments. They don't. You can't strengthen them. You can only weaken them with wear and tear. The muscles, the dynamic stabilizer, which is a rotator cuff, are very important to strengthen up, as well as the muscles of your scapula, making sure that your shoulder blade moves properly as well. Doing proper mechanics is also important to make sure that one muscle is not used more than the other. What can happen with a swimmer, a throw, and so forth? The rotator cuff are small muscles. Therefore, they fatigue easy. By fatiguing easy, the other muscles of the shoulder specifically the deltoid, will pull the shoulder up and actually pinch the rotator cuff underneath the acromion right here, as you can see on this. The deltoid pulls it up and you actually pinch it right there. So it's important to work the rotator cuff muscles pre-season if you're an overhead athlete. That means volleyball players, that means baseball players, softball players, and swimmers.
Very important. I think it's very important when he's saying is working it properly, knowing how to work all the muscles in the shoulder, not just working the muscles in the front, working the muscles on the side and the back and underneath as well. So you really need to know what you're doing when you're training the rotator cuff or the shoulder joint. You really need to get involved with a trainer or a physical therapist that can show you exactly what exercises you need to do.
We are taking questions here tonight. Remember, the numbers are 856-767-8884. The toll-free number is 1-888-634-7488. If you want to email us, it's at wpsj@aol.com. We actually have a call on the line. I believe it's Barbara from Norristown. What's your question tonight, Barbara?
I have a fractured olecranon with 2 pins in both the ulna and radius. I was wondering what the expected healing time is for something like that.
When did you hurt it?
I fractured it on May 26th, and the surgery was on May 28th.
So right now, usually fractures like that will take about 6 weeks to get to a stage of healing. The body actually, the healing process goes on for a year. But you want to know when your elbow can heal and you can start doing things. It's hard to say without looking at the x-rays, because you can have a clean fracture or you can have a fracture, what orthopedic surgeons call comminuted, which means a lot of little pieces. Depending on the configuration of fracture will depend on the heal. But the average time to start, to get well into healing is about 6 weeks, but it can take up to 12 weeks to really get good healing before your doctor will let you move your elbow. And it depends on your doctor, and it depends on his experience as well. And every fracture has its own personality. Every person is different as well because of their medical problems. If you're a smoker, your bones heal slower as well. So I can't give you an actual time. I can give you a range. I would say about 6 to 12 weeks.
There's really a lot of factors to play into that.
Oh, absolutely. Healing, bone healing is you got to remember, bone is not it's not wood. Bone is a organ. It remodels. It is constantly going through a reparative process as well as a breakdown process. So you got to remember, you have to. Good bone health is important.
I think it's very important. I think it's things that we talk about every day. We talk about telling people all the time to try to stay in some type of physical condition, good physical condition, because what we find, especially in rehab, that the people that are in good condition usually rehab back 5 times faster than someone that is not, because of the exact reasons we're talking about tonight. They're not going to have the soreness. They're going to have better blood circulation. They're going to have better flexibility, and they're not going to have to go through these the sorenesses and limitations that the people that are not in good shape would. So they get right
we're pretty popular tonight. We got another call on the line.
Right?
Yeah, Bridget from Washington Township. How can we help you tonight?
Hi, Bridget.
Oh, we lost that caller. I hate when that happens.
Oh, that happens.
Okay. We're going to take a break right now. We'll be right back after this short message.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Welcome back to Sports Doctors. I'm Merrick Wetzler with South Jersey Orthopedic Associates. I'm here with Dave Anselmo from Cross Keys Physical Therapy. Dave is offering us free sports evaluations. If you have aches or pains, you call Dave. You can call him at his Sickleville office at 729-1900. His Washington Township office, if it's his 374-3707. His Woodbury office at 853-0988. Or his Penville office, for those down south by Delaware, 678-8000. We have Pam from Springfield, PA on the line. How can we help you, Pam?
Yes, I have a son who plays D1 lacrosse for a college. He has 2 cracks in his L4 and 2 in his L3 vertebrae. And I was just wondering, one doctor I've taken to has recommended that he not play and redshirt for a year and maybe play next year. The other doctor has said, wear this brace and you can play.
Well, I would have to say I'm probably closer to the second doctor. I would see someone, if you go to see a normal spine surgeon or a neurosurgeon, they're a little bit more cautious because of how they're taught and their experience. It's all about how you experience, how you treat patients. My philosophy, and it sounds like he has what they call a spondylolisthesis. Tell me if I'm correct on that. It's not.
Yeah.
It was a stress type injury rather than a traumatic type injury.
Right.
And my philosophy is, if you get pains free, you put him in the brace. You have him do a lot of stomach strengthening exercises, a lot of back strengthening exercises, what we call pelvic and lumbar stabilization exercises, and you let him in a brace. And if he's pain free, we let him play. Also important, and people don't realize it, but stretching the hamstrings is real important. The quadriceps and the hamstrings. You got to remember, the hamstrings attached to the pelvis. If your hamstrings are tight, your pelvis tilts down. So this is the front, this is the back. If your hamstring's tight, it tilts the pelvis. By tilting the pelvis, to keep your back up straight, you have to arch it more. This puts much more stress on your vertebral column, and sometimes can result in the same things. You know, I had the same thing as your son back when I was in college, and I ended up wrestling in college and finishing up without a problem. So I would say do what you need to do, trust your gut on that one, but it's important to wear the brace and do the exercises as well.
So it really depends if he's strong enough to be able to handle that.
Exactly. I mean, it also depends on his hamstring tightness and his amount of pain. Exactly. If he's not in pain, then that's a good indicator.
That's right. And once again, we talked about flexibility. It's very important to maintain your flexibility. So that's another good factor that would play into his part of staying healthy.
We have another caller on the line. It's Kevin from Delaware County. How can we help you tonight?
Yes, I'm calling. I've had 2 knee surgeries. I had 2 patella tendon tears, and the left leg healed completely. I can build it up. My right leg can't seem to build it up, and it has. I'm wondering if I should get it checked out. I mean, it makes a clicking noise, like tearing noise when I bend it up. I'm not saying it's tearing, but it makes a noise every time I bend it, like crumbling paper.
You did this. You did the one we're talking about much later in life than you did the first one, I bet.
Yeah, well, actually, they were a year apart.
Oh, okay. You know, people ask me about clicking all the time. If clicking was a big problem, I would be in a lot of big trouble. You know, we all wake up in the morning, Dave, we all wake up and you hear our whole body pop, crack, snap, crackle, whatever. You'll hear that. The scientists still don't know what makes all these clicking and popping noises. What you're talking about with your knee is what we call crepitance. When you're moving your knee, it sounds like what we affectionately call Rice Krispies. And as long as it doesn't hurt, I really don't think it's a problem. Now, why is one knee worse than the other? There's a lot of factors that going into that. It depends on, how well that tear was fixed, how quickly your muscle atrophy afterwards. Is it your dominant leg, your non-dominant leg? There's a lot of factors to it, and it takes time. I would just give it some more time and trust your doctor and keep going with it. All right, John from Mount Laurel, how are you doing tonight? What's your question?
Good evening, Doctor. My name is John, What I want to speak to you about, I didn't have a sports injury, but what I had a full knee replacement, right knee, back in October. Now, since then, I have been hardly able to move this leg. It is swollen, it is sore. I find it very difficult to walk or stand in any one position for any period of time. I have had weeks and weeks of therapy, and I just can't stomach taking these medications or these not antibiotics, but these heavy drugs to combat the pains. But I find it very difficult to stand straight, to walk straight, or even to stand in a position for any period of time. In other words, I have a lot of pain in the knee, and it's very difficult to keep going the way I'm going right now.
Oh, that's a shame. I really feel for you. The problem is that the body, you know, anytime you go through an operation, the body goes through a reparative process. Some people have a much stronger reparative process. Sometimes the body goes overwhelming, and you get the scar tissue and building up. It sounds like you have what they call arthrofibrosis of your knee. Have you had it manipulated at all, or injected with a little cortisone, or even sometimes they'll even scope a total knee replacement to take out some of the scar tissues? Those are some of the suggestions I have for you, and I wish you the best of luck on that. Hey, we have a call from the outlet capital of the world. I believe it's from Reading.
All right.
Gladys, what's your question?
My question is, if you pull a hamstring, does that cause a pop?
Oh, absolutely. You can feel, it's more commonly you feel the pop when you pull your calf muscle, or if you tear your Achilles. But yeah, you can feel a pop in your hamstring.
The reason I ask that is because I was moving some things in the house here, and I stooped over without bending my knees, foolishly, and I reached away from my body, and I felt this pop, and ever since then, I've had a lot of pain. No matter how I sit, it hurts. And I've gone to my chiropractor, and he told me I pulled the hamstring, and I was wondering.
Well,
if
I'm
that's
not sure if a chiropractor is the best person you should go to for a pulled hamstring. I think that you should see a therapist or your family practitioner, because you know, chiropractors do a lot of good, and they're good at what they do, but I think that you need someone who specializes in the musculoskeletal muscles as well as the rehab part of things, because I think that it's important to rehab your hamstring, especially someone who's a little bit older, because you want to get back to the quality of life you had before, and I think that's important. Talking about you know, getting back into rehab, I just want to remind you that Dave is having free evaluations at all his offices. Just to reiterate the numbers, Sickerville is 728-1900. Washington Township is 374-3707. Woodbury is 853-0988. And Pennsville is 678-8000.
Call in his offices and schedule up.
All right, we got Rose from Penfield. How you doing tonight, Rose?
Hi, this is Rose.
Hi, Rose.
Dave.
Hi, Rose.
This is Ricky's mom.
Hi, Rose.
I just want to say that since Ricky has been going to Cross Keys for therapy, he's progressed quite a bit. He had a motorcycle accident back in '93 and was told that he would not be able to walk anymore. But since he's been going to Cross Keys with a therapist there, Dave and Jennifer, they have been a big help to him.
Well, thank you very much.
I would recommend.
Didn't prompt this phone call.
No,
you didn't.
I'll pay you later.
I would recommend anyone going to Cross Keys for therapy.
I mean, we're lucky around here. I mean, Dave's organization is very good, but we're lucky. I'm very lucky in this area. There are a lot of good therapists in this area, and a lot of Dave's colleagues are excellent as well. It just goes to show you how important therapy is. You know, therapy, you cannot underrate the importance of therapy, especially after an injury, especially after an operation. You know, I tell my patients that I've just done 50% of the work. Now you and the therapist have to do the rest. And
that's very important. He says that. It's very nice of him to say that. But on the same side, it's real important with orthopedic surgery, because with therapy, you only can do as much as good as the surgery was. So if the surgery wasn't done properly, you're not really going to do too much with therapy. So on the other side, you really need to see a surgeon that really knows what they're doing. So it's very important. We're lucky in this area because we have a lot of very good surgeons, so that helps us to rehab back the patients. So
we have Kathy online from Delaware County, I mean, sorry. Kathy?
Yes. Hi.
Your question tonight, please?
Hi. About a year ago, I fell and hurt my arm.
I hate when that happens.
And I went to the doctors, and they treated me without looking at anything, doing x-rays or anything, and they told me it was a rotator cuff. And they treated me for that, put me through therapy. About 2 weeks went by, and the pain kept getting greater. So I finally went and had an MRI done, and they said it was a fracture of the greater tuberosity. How should that have been tended to?
You know something, probably no differently. The greater tuberosity is actually right here, and as you can see, that's right where the rotator cuff attaches. So it's actually treated about the same. It's more with the MRI nowadays. Usually we wouldn't have picked that up before MRI, but with MRI we now pick that up. It's almost, I wouldn't call it exactly a fracture. It might be more like a very bad bone bruise. And the treatment for that is to reduce your pain, restore range of motion. Once you've got pain-free range of motion, we start strengthening. You know, sports injuries is common to everyone today. It's how you handle them is how you get back. Dave's and my job, we're lucky in that we get to restore people to the quality of life. And if you do have a problem, you can give Dave a call at one of the numbers that I had given you, or you can look on the internet and so forth. Thank you very much for, and here's the numbers you can call that are on the screen: 728-1900, 853-0988, 374-3707, as well as 678-8000. I'd like to thank Dave for this. Is pretty fun.
Oh, very
Maybe
fun.
we'll have to do it again sometime, you know?
Definitely. This is a great way of doing it. Thanks for calling.
Have a good night, and good night from Sports Doctors.